I'm Laval Miller-Wilson. I have the privilege of being the executive director of the Pennsylvania Health Law Project. Medicaid is our country's healthcare safety net. And in contrast to Medicare, it's a shared partnership with the federal government and the Commonwealth of Pennsylvania. For 50 years, it's provided health coverage for low-income children, low-income seniors, low-income persons with disabilities. It's not just about being poor, it's about being poor and falling into a particular category. That's a big misperception about what Medicaid is. Today, federal law requires Medicaid to provide a minimum package of benefits. It includes hospital visits, visits to the doctor. It also, for kids, requires a stronger level of health services. We call that EPSDT, early periodic screening, diagnostic, and treatment. Also part of the federal law is long-term care services for persons with Medicaid. So it pays for nursing homes, it pays for home and community services for people with disabilities. Applying for Medicaid requires someone going to a county assistance office, bringing their pay stub, bringing proof of residence, presenting themselves or the Medicaid beneficiary and saying, here I am. And then enrolling in a Medicaid plan is a bit simpler. We have something called Health Choices in Pennsylvania, and you enroll in a managed care provider. And there are few exceptions to that.
Under the Affordable Care Act, states can choose to expand their Medicaid coverage to include more people.
Currently, if you make $15,000 a year as a single person, you can't get into Medicaid. You're poor, but you don't fit into a category. Healthcare reform says we're going to have a level throughout the nation of 133% of federal poverty, approximately $15,000 a year. If you make that amount, then we will put you into the Medicaid system if you like. And so that's a big game changer. That will affect millions of Americans, and it's projected to affect as many as 600,000 to 800,000 Pennsylvanians.
Pennsylvania has not yet made a decision on whether to expand Medicaid.
Without Medicaid, people in the categories that I described will be uninsured. They'd lack medical coverage.